Hello, Jasmine and I are going to be presenting on developmental coordination disorder, also known as DCD. So, what exactly is DCD? It is also known as dyspraxia. It is defined as a neurodevelopmental disorder that impairs a child's ability to perform coordinated motor movements and causes difficulties while trying to learn new motor movements. A key feature that you would see with a child with this disorder is that they perform slow, clumsy, or inaccurate movements, as these are very typical for a child with this disorder. This disorder is frequently diagnosed along with autism spectrum disorder, ADHD, developmental language disorder, learning disabilities, and cognitive impairments. So it is very common to see DCD diagnosed along with another disorder. So, after researching the cause of dyspraxia, I did find that further research is needed as little is known about the causes of this disorder. But I did find that abnormal neurological maturation processes do occur. It has been found that the underdevelopment of motor and sensory pathways, along with the abnormal parietal lobe and posterior cerebellar regions in the brain, do contribute to the etiology of this disorder. It has also been found that prematurity and very low birth weight may be related to this cause. And it has been found that dyspraxia is 7 times more common in males than females. The current prevalence in the United States at about 5 to 6% of all children. So it ranges from about 1 in 17 to 1 in 20 school-aged children in the US may be diagnosed with dyspraxia.
There are some clinical symptoms that come with DCD, and unfortunately, there are many occupations that are affected. So, starting off with the motor symptoms, a big one is having clumsiness and awkward movements, and this affects a child's ability to participate in anything that involves gross motor skills like running or playing ball games. Even engaging in recess at school or PE class, it can become a really stressful event for them. Another symptom is having poor balance and coordination. So imagine trying to navigate a playground or ride a bike without having that balance and coordination. So a kiddo won't be able to climb stairs or jungle gyms without it being difficult, and it can even be unsafe for them. Another one is executive functioning difficulties. Kids might have trouble organizing materials at school, following step-by-step directions, and even using scissors. So even basic routines like brushing teeth can feel overwhelming because they're not able to properly plan in sequence. Another challenge is that they're slow at learning new motor skills, and this really affects their development and in-hand manipulation skills, which in return can affect their handwriting skills, which is really important for their engagement in school. And it can also affect their engagement in sports because they lack that anticipatory movement. The next clinical symptom is having poor organizational skills, and this can really impact a kiddo's ability to engage in a classroom setting. So they may not be able to manage time appropriately between academic tasks or even locate personal materials in a desk or even their backpack. Next, moving on to the psychosocial symptoms. So there is a lot of avoidance to physical activities, which can lead to obesity. And when a child consistently avoids that exercise, then they miss out on having recreational opportunities, and over time, that becomes a health concern. Another symptom is social isolation, and they have difficulty making friends and maintaining friends. Many kids with these challenges, it can affect how they engage in classrooms, with other peers and even group activities, their social participation ends up being very limited, and it makes them feel very left out. Another symptom is having low self-esteem. It really goes, all of this pretty much goes hand in hand. But if a child feels like they're always behind or can't do things well, they may avoid trying new activities, especially ones that they know that might be challenging. And even if the activity is something that they think they'd enjoy, it's like they have this fear of failing and that they don't end up participating. So that just shows that they really have a lack of leisure exploration. Another symptom is having anxiety and depression. And of course, when you have that, you don't have the motivation to really want to do anything. So if something feels like a struggle, especially tasks that need coordination and effort, then these kids might start avoiding those type of activities altogether. So that just means they'll be less engaged in games, sports, and any play that has to do with physical movement. So unfortunately, there are no medications that treat DCD specifically, but there are co-occurring conditions that come with DCD, and the medications prescribed for those conditions can impact OT participation. So the most common conditions, as we mentioned earlier, are ADHD and autism. So with ADHD, a medication prescribed is usually a stimulant, which is known as Adderall. And the side effects for that is having sleep disturbances, having a loss of appetite, abdominal pain, and headaches. So just imagine if a kiddo went to an OT intervention for that day, they're not going to want to participate from having all those symptoms. Another medication are antipsychotics, known as risperidone, which is most commonly prescribed for kids with autism. So side effects for that is feeling like they're sedated, having fatigue, having an increased appetite, and GI issues. So also for that, that if a kiddo is feeling that way, they're just going to have more agitation, and they're not going to want to participate in any activities. Another medication is selective serotonin reuptake inhibitors, which is often prescribed with anxiety, and some side effects for that is fatigue, decreased attention, and GI issues. So now we're going to discuss the role of OT and how OT manages symptoms of DCD and how OT helps address the challenges that we spoke about earlier. So first, during evaluations, OTs will use standardized assessments to help understand how a child's motor abilities is affecting their daily activities. So one common screening tool that's often used is the Developmental Coordination Disorder Questionnaire. And this is a 15-item parent report that looks at how children manage everyday motor tasks at home and at school. Then we have the BOT second edition, which is now there is a third edition, but this evaluates the fine and gross motor skills. There are 8 composites in here, which is known as the gold standard for evaluating praxis. So this one is often used. Another assessment is the movement assessment battery for children, and this really assesses the manual dexterity and balance in kiddos. And also the Vineland Adaptive Behavior Scale, and this looks at social and organizational skills that are needed for ADLs. So OTs will use a frame of reference to help guide their interventions. So in order to address praxis and cognitive deficits, OTs will use the cognitive orientation to daily occupational performance approach. And the interfering occupations with this are often dressing, play, and academic performance. So that being like scissor skills and handwriting. So by using this frame of reference, this focuses on improving motor performance by teaching children cognitive strategies and helping them learn how to problem solve. And they get to choose the activities that they want. To address delays in skill acquisition, OTs will use a developmental frame of reference, and using this approach will help the child build new skills by engaging them in tasks that are just right above their current level of function. So by just gradually challenging them, it can really support and help them progress in occupations like play, social participation, and self-care activities. Now, to address impairments in motor planning, sequencing, and execution, OTs will use the motor control and motor learning frame of reference. And this helps children develop new motor skills by repetition, feedback, and doing task-specific practice. So this will help in activities in play and leisure. Some other therapies that are often involved with kiddos with DCD is physical therapy. So physical therapy, they focus mostly on gross motor development, and educational support, which will help with school participation, and then also behavioral therapy, which can help with emotional regulation. Moving on to the prognosis of DCD, it does make an impact in adulthood. So one being education access and achievement, and this can be impacted due to the poor handwriting they have and execution function difficulties, and this can lead to lower academic performance, and that can carry over into other areas of life. Also, employment and economic achievement. This can be affected, especially in jobs that require fine motor skills, spatial awareness, or fast reaction times. Also, housing access, that kind of goes hand in hand with employment, because if there are limitations of employment, then it can be hard to have housing, especially for those who have more severe DCD symptoms. As for healthcare access and quality, it can be helpful to receive services, because there is currently a need for more interprofessionals in the field to take care of that. So it's not always available. And then social isolation and community integration is really common. Many individuals with DCD, they struggle with confidence and they feel like they don't belong in the community. So that can make it harder to connect with others.
So continuing on with prognosis, as a child with DCD gets older, they may experience intimacy in marriage, which unfortunately will be affected if they have low self-esteem, anxiety, and difficulty with executive functioning and social participation limitations once they reach adulthood. Next, they may have emotional stress and carry a burden of managing complex care routines that impact caregiver and families around them. Next, we have a real-life example of an adult living with dyspraxia. So Verlinden et al. 2023 conducted a study. They interviewed a 19-year-old man with a gambling addiction who also, like I said, has ADHD and dyspraxia. He stated, "I declare being socially anxious, afraid to fail, and being laughed at by others." He also stated, "My social life is not extended, and I make friends through online gaming platforms." Once again, this is a real-life example of how a child with dyspraxia may grow up into adulthood with certain symptoms.
Now, moving on to our case study, we have Kevin McAllister. He's an 8-year-old boy who was diagnosed with DCD when he was 6 years old. He currently lives in a 2-story home in Chicago with both of his parents and his 4 older siblings. Kevin enjoys watching movies, listening to music, traveling with his family, and playing with action figures. He currently attends the 3rd grade at the local elementary school and has a small group of friends. He is currently receiving OT services in an outpatient setting once a week for 60 minutes. Due to his DCD condition, he has gross and fine motor impairments, motor planning deficits, self-care and sensory issues, and psychosocial difficulties.
So moving on to Kevin's present level of performance, he is currently struggling with dressing himself independently due to sequencing impairments and trouble problem solving. Kevin currently requires frequent verbal cues and demonstrations to complete tasks, specifically from his parents and teachers. He shows difficulty with learning new motor tasks that come along his way. An example of this would be learning how to use a fork and knife to eat while eating a meal. Kevin also, when he's at school, he has difficulties with handwriting and using scissors to cut paper. He typically needs assistance organizing his backpack and his lunchbox. He currently avoids playing with his peers during recess due to the fear of failure and possible embarrassment. He becomes emotional when tasks become too difficult for him or seem too rushed, so he seems to become upset and throw tantrums. He occasionally displays poor body awareness as he bumps into things around his home and his classroom. So currently, Kevin is having difficulty participating in dressing and using scissors. So he is first having difficulty with tying his shoes, which falls under the dressing and ADLs category. The performance skills that are limiting his abilities to complete this task is initiating, continuing, sequencing, and terminating. Some client factors here that are limiting his abilities are higher level cognitive functions, his control of his voluntary movements, mental functions of sequencing complex movements, and the structure of the nervous system, specifically the brain.
So the next occupation is using scissors, and this falls under the formal education participation and education category in the OTPF. So the performance skills that are limiting his abilities are coordination, calibration, flows, and initiates. The client factors that are limiting his abilities are higher level cognitive, mental functions of sequencing complex movement, proprioceptive functions, control of voluntary movement, and orientation. And that concludes our presentation. Thank you for watching, and here are our references.